can you give us a definition of heart disease?
Yeah.
What causes a heart attack? And what is our goal in terms of having a healthy heart? Is it about valves or elasticity or explain what we're aiming for also?
Yeah, no, great questions. And I'm gonna start at the end, almost like a movie that starts at the end and works its way
Okay.
backwards. So the goal of any care, of any healthcare provider is one of two things: to help a person feel better and live longer. That's it, right? Now, part of live longer in many instances, specifically as it relates to the heart, can mean trying to keep you from having a heart attack. That falls under that bucket that's there. But those are very simple goals: how you feel, symptoms and so forth, minimizing that, eliminating that, and then potentially preventing this catastrophic event called a heart attack. So now that's the goal. So let's take it back to the beginning. So what we know about heart disease is nothing new. It's been known since the days of the pharaohs, and studies have shown and demonstrated that we've identified this. And the best way I can describe it is that we're beautifully and wonderfully made, and we have this intricate network of vessels. Think of these vessels as water hoses. They're going and delivering blood all throughout the system, and they arise from one singular pump called the heart. Now, this heart is wonderful in that although it gives off these big, these garden hoses, these pipes, these rubber pipes that are there, it also feeds back to itself to deliver blood to the heart muscle. These pipes can get clogging inside of it, just like your pipes at home. And so you can have where you have that small, mild green corrosion that occurs if from the heart water that's been there. Okay, well, it's not obstructive. We may say that you have a little bit of hardening of the vessels, like that hardening that happens there. We'll say, call that arteriosclerosis, which is hardening of the vessels. Another way to think of that is that if you have that pipe and it's inside the desert, this rubber hose, it's going to get hard if it's baking in the sunlight for a while and get stiff. So when your vessels get stiff, that's arteriosclerosis. Now, when those vessels become invaginated with like a creamy, rubbery type of substance, right? Think of it as if the kids or someone just stuffs a bunch of toilet tissue down the toilet or the pipes, and the pipes get clogged. You get this area. Now you begin to have restriction of blood flow. And that's what we typically characterize as atherosclerosis, or we also call that coronary artery disease.
Okay, so there's
Now,
arterial sclerosis and atherosclerosis. Did I pronounce it?
correct.
Okay, got it.
That's
I did not
perfect.
know that. I did not know the
Yeah.
difference. Mm-hmm.
So easy way to think of it is hardening of the vessel. The other one is an invagination of the lumen of the vessel that will begin to happen, or the wall, right? The wall is probably being more specific. So within each of your arteries, you have
I've never
three
heard of the word
layers.
invagination, so I don't know.
All right, all right, here's another way to think of it. All right, there's a simple way. If you're drinking, let's say that you're having a smoothie, a fruit smoothie, and you decide to, or you're having boba. I don't do any of that boba stuff, but my daughter likes that boba stuff, and so they have these big, huge straws with boba. And let's say you have a real small straw that you're drinking your fruit smoothie, and there's a piece of fruit that isn't completely blended up. It'll get stuck in that straw.
Mm-hmm.
And so now, as you're trying to extract the fluid, it's obstructing it. And so the same thing happens inside the lumen of your vessels, is that you have a plaque that forms, or you have an obstruction that forms. This obstruction is typically comprised of inflammatory products. That is where the cholesterol comes into play, and it will build up over time.